So medicine is all about individualized, it is all about precision rather than like one size fits all. Even the agarbattis which they put inside the house actually is a form of an indoor air pollutant.
Is it really late to ever quit smoking?
So from adrenaline to ecstasy would be the ideal one.
Welcome to the program, Doctor, and it's a pleasure to always have you.
Thank you, Dr. Lakshmi, for the kind invitation.
So, you are now an interventional pulmonologist. Was medicine always on the plan, or you want to become something else or someone else at any point?
Well, I think this is a question which you will be asking most of the doctors in your interview. But I think it's just a calling. I feel like people who become doctors, at least in some part of their early parts in their life, they would have aspired to become a doctor, because this is not yet another profession. Beyond a profession, it demands a lot of sacrifice and a lot of empathy and a lot of courage to pursue this field. So I think only people who are really passionate about doing it generally tends to become a doctor. Even in my case, definitely I wanted to be a doctor since I was a child.
Found your passion for lungs here.
Yeah, finding the passion for lungs, that is a story by itself. Initially, I wanted to be an oncologist. That's how it started. But what I realized is down the lane, when I was doing my medicine as well, like I found a lot of people suffering from lung cancer. So that's how I got fascinated regarding this field of pulmonary medicine. And once I started exploring it, I found out that in India, you see a lot of patients having chronic lung problems, like be it a COPD or asthma or ILD, not only lung cancer. Then I thought that I will be able to make some meaningful contribution to the lives of these people by becoming a pulmonologist.
So I'm sure your training has its own share of blood and sweat and sleepless nights, of course. But was there a moment you thought, oh no, this is not from the textbook?
I think every day you will feel like it's not from the textbook. So that's the beauty of medicine. So just to put it to our audience here, like what we say to the patients as well when they ask about what is going to be the outcome, we just say it is not a mathematics. 1 + 1 is never going to be 2 in medicine. So medicine is all about individualized. It is all about precision rather than like one size fits all. So it never happens that way. So many times you read so many things in books, you get so many knowledge from internet. Now you have a lot of these chat GPTs provide you with so much of knowledge, but at the end of the day, it is between you and the patient.
Previously, you've mentioned that, we have seen so many chronic lung conditions, especially in our country. What exactly is lung allergy, or is it some fancy terminology?
So allergy is, I would say, like it's not a disease per se. It's just like how your body reacts to a particular substance. For example, a person who is having an asthma, which is a form of an allergic lung disease, at one place he may have a lot of symptoms related to asthma, but when he moves out from that place and goes to some other place, he doesn't even perceive these symptoms of breathlessness or cough.
It's the environment.
Yeah, it's the environment. So it is not like once you are born with allergy, you are going to be allergic for rest of your life. As a pulmonologist, it's our prime duty to make the people understand that asthma is not as dreadful disease as it is being shown outside. It is something which can be effectively controlled and it can be effectively treated, and you can lead a relatively normal life. For an example, there are many athletes, there are many people who are involved in high stressful jobs demanding physical activities. They are asthmatics, but they go on with their work quite comfortably by taking proper advice and proper medications.
How about pets at home, like the cats, dogs, and the birds? Do you think there's a scope for them to cause some allergies?
Yeah, definitely. And it's a very, very important question, especially in a city like Hyderabad, where many tend to have pets, be it a cat or be it a dog, and even sometimes parrots and those things. So essentially what happens with the pets is they tend to shed a lot of hair, and these hair are like very tiny, and they circulate in the air as well. These what we refer to as an animal danders. So accidentally, if you start inhaling these danders, it enters into your windpipe and starts irritating your windpipe, which is already inflamed because of an underlying asthma. So they tend to have an uncontrolled asthma. A simple way of preventing this is to prevent the shedding inside the house.
Especially for people who are more prone to this and have
Exactly.
risk factors.
True. And another important problem is these pigeons and parrots. So they not only worsen your underlying asthma, but they can also make you prone to develop what we refer to as an interstitial lung disease, which is a form of a chronic lung condition where your lungs shrinks in size and eventually you start becoming breathless even on performing your day-to-day activities. So it's a form of an interstitial lung disease which can develop especially when you inhale these proteins which are contained in the feather as well as in the fecal matter of these parrots and pigeons. Once you know that you are allergic to that sort of animal or a pet, then trying to avoid contact or taking utmost precautions would be the ideal one.
So not just the external environment, but also the environment at home is so important for our lungs health, isn't it?
Yeah, definitely. That's something which is grossly neglected in India. When we see about pollution, when we hear about pollution in the news and everything, we always speak about outdoor pollution. So you see a smog, you see vehicular traffic, but what is given the least importance is your indoor pollution.
Absolutely.
For example, even the agarbattis which they put inside the house actually is a form of an indoor air pollutant. It releases a lot of these toxic fumes and we accidentally inhale them, which can affect our lungs. And even as I said to you before, this animal danders is a form of an indoor pollutant. And sometimes even painting works which are happening indoors and construction activities which are happening indoors, and even damp walls. For example, you can see the ceiling of your house which is just below a water tank or something. It can have a damp walls, and these damp walls become a source of fungal exposure. So it can also contribute to your indoor pollution.
How about these air purifiers? Do you think they're worth it, or are they just overpriced fans?
So to be very honest, we don't have robust scientific data to say whether your air purifiers really make a difference in terms of indoor pollution and its impact on health and lung functions. But to be very honest, if you can afford it and if you can use it, there is no harm in using it. Definitely, you can have it. But the most important thing is it is not like you can keep it in a open room or something. You need to have a closed room where the new circulation of the air doesn't take place, and it can only purify a certain amount of air. It cannot purify like every large quantities of air. So it has its own set of limitations, and you need to make sure that you change these filters often as per the instructions of the manufacturer.
So talking about lung health in general, doctor, I don't think we cannot talk about smoking. So what exactly happens when you smoke inside, literally? Can you give us an inside scoop? What's happening?
So to put it in a very, very simplistic way, let's say that you burn your skin. What essentially happens, you see outside. Same thing happens inside when you're taking a smoke. Whenever you smoke, it is going to burn the surface of your windpipe, and it can even affect your lungs. And apart from just the physical burn it produces to the windpipe and the lungs, causing inflammation, there are certain toxic chemicals in these cigarettes or any form of smoking. So it can be in the form of a tobacco, it can be in the form of aromatic hydrocarbons. So the problem with these chemicals is that it not only affects the lung, it can affect any part of your body. That is why you see that a person who smokes doesn't suffer only from conditions related to lung, like lung cancer or chronic bronchitis or ILD. He can also develop cancer in any part of the body. Apart from that, it is not only going to affect you as a person who is smoking. It is also going to affect your near and dear ones because of the effect of the passive smoking or the second-hand smoke. So you smoke and you leave, but the smoke becomes an important part of an indoor air pollution.
So we've all heard that smoking is really injurious to your health about a million times. Is it really late to ever quit smoking? I mean, can your lungs heal?
Yeah, definitely. I think anytime you make a decision to quit smoking is going to be beneficial to you. The moment you stop smoking, you will start feeling that your energy level starts improving and your concentration becomes much better. And even the side effects which has happened to the heart, to the lungs, to every system in your body slowly starts healing. So I think if you are determined to quit smoking, then today is the day where you are going to quit the smoking, because it is going to have a lot of impact on a quality living, and I think that is something which should be encouraged.
So, being an interventional pulmonologist, I'm sure you get to work with some new tools and new scopes every day. I mean, do you really get excited like how we get excited about iPhones?
Right now, we have something called as a pulmonologist and an interventional pulmonologist, which means that we use certain instruments to go and directly see inside your windpipe and lungs and do surgeries in a much more non-invasive way. So it is more like what we refer to as a bronchoscopy, or we have certain advanced forms of bronchoscopy. We call it as an endobronchial ultrasound or an EBUS. This has made things so simple that even for getting biopsies from critical locations in your lung and in your chest, we don't require any sort of major surgeries which will cause opening up your chest wall and so on. We just go do it as a day care procedure. We go inside your airway, we see these structures, we take biopsies, and sometimes on table we are able to confirm whether we are dealing with a tuberculosis or we are dealing with a cancer, or what a problem the patient is really suffering from. Apart from that, we also do certain advanced lung cancer related surgeries. So for example, if there is a tumor which is blocking your windpipe and you are not able to breathe, previously you have to resort to major surgeries, or you have to go to oncosurgeon to open up the chest and do. Right now what we do is we go through the bronchoscope, we remove these tumors. We also put something called as a stents, just like how for a heart block you put a stent, we put some stents for the windpipe, and the patient goes back home walking the same day. So this was never thought of and never believed to have occurred until and unless the interventional pulmonology really took a major step. Apart from that, one another indication where interventional pulmonology plays an important role is when you have fluids in your lungs. We call it as a pleural effusion. So previously you need to go for a big vat surgery where you need to open up the like you need to put 2 or 3 ports into your chest and do the surgery. Right now we do with thoracoscopies most of these procedures. Only for selected few we require our thoracic surgeon to do it.
So, undoubtedly, you work with some high stake procedures, navigating inside people's lungs. So, how do you keep your mind calm and how do you do all this?
I think it is again part of your training as a doctor. As I said to you before, it's all about passion. Like I don't think you can become a good doctor without a passion. Until and unless you are passionate about what you do, I don't think you will reach the level of satisfaction and excellence which you want to reach. So yes, we go through a lot. For example, when we decide to do a procedure for a patient, it all starts with a proper planning. Once you start doing it and once you really start seeing the benefits of these procedures and patient going home without any complications, then you feel that what you have done is right, and this gives you a lot of confidence to take up more challenging cases. And it's been 6 years into this field of highly adrenaline rush interventional pulmonology, and day by day what we realized is now we started enjoying it. So what was like initially a very complex and a stressful procedure is now we are able to do it almost like 100% perfection, sending home patient with almost nil complication as a daycare basis, which means that we have grown over the years. And that is where I say that experience matters in medicine. It's not a textbook. Just because you read a procedure or you see a procedure, it doesn't make you fit to do a procedure.
So, on a creative note, if you could turn your life or your profession into a medical drama, what would you name it?
I think Adrenaline would be the title of the movie. Maybe so from adrenaline to ecstasy would be the ideal one.
I think that's very aptly described, Doctor. So before we wrap this episode, is there any message that you would like to share with our audience as far as lung health or preventive medicine is concerned?
So I think one of the important things which I really want to stress to the public is about the use of ECMOs in lung transplantations. We have spoken in length about what are the advanced interventional pulmonology, but what we see day in and day out is not only about interventions. We see a lot of patients suffering from this end-stage lung diseases, which we refer to as an ILD or the interstitial lung disease, where the lungs get shrunk in size because of multiple reasons. It can be because of exposure to the birds or because of connective tissue disorders or because of smoking and so on. And essentially, it brings them to a point where they become oxygen dependent even for performing their day-to-day activities. So previously, many of these patients were left with oxygen for rest of their lives. But right now, we have very effective modalities in the form of lung transplantation. And that is something which we are doing it for almost 5 years now. And we have seen that this lung transplantation brings about almost a second lease of life for these patients. And they can do all their work without the need for oxygen. Another important thing which I really want to stress is something called as an ECMO, which just like how when your kidneys fail, you put a patient on dialysis. Likewise, let's say that you are on a ventilator and you are given the maximum support, your body oxygen is not improving. It doesn't mean that it's the end of the road. That is where you have this utility of what we refer to as an ECMO. You put these patients on ECMO, buy time, treat the underlying process, and we have seen many such patients coming out of ventilator who are considered to be like nothing could be done for these patients. There were instances, especially recently, we had a patient from Karimnagar. She was deteriorating. They put her on ventilator. They couldn't improve her condition. The doctor immediately gave us a call. Our team went from Yashoda Hospitals to Karimnagar, initiated ECMO in their hospital, brought the patient back here. We treated this patient. 4th day, the patient came out of ECMO, and almost 7th day, the patient is out of ventilator. In the interest of time, I'll just narrate a very short experience of one another patient. He was a 12-year-old boy who came to us. He had an accidental poisoning and with a substance called paraquat, and it started affecting his lung. His lung was in complete shutdown. Put on ventilator, didn't recover. We immediately started this patient on ECMO, and we did a lung transplantation for a 12-year-old boy. And now this boy is doing all his work without the need for oxygen. So this is what ECMO and lung transplantation can actually do. And we are very lucky to work in such an advanced center which has gotten access to the ECMO and the lung transplantation. But I think even as a doctor or even as a common public, I think we need to generate a lot of awareness about ECMO and transplantation, because this is what is going to stand between a life and a death for a patient on ventilator.
So thank you, Dr. Viswesvaran. It was wonderful interacting with you.
Thank you, Dr. Lakshmi.